I am going to open up the hearing for House Bill 5247. This is House Bill Representative Amore has set up. Representative Amore, are you with us?
I am with you, Chairman Casey. Thank you.
Thank you. Go right ahead, sir.
Thank you, Chairman, members of the committee. I know you've had a long night. It's nice being at home when you don't have to hang in there in the room for the entire time. This bill has been presented to the HEW committee for the past 3 years. For the past 2 years, it passed the committee unanimously and passed on the floor unanimously with bipartisan support. This bill is on behalf of my constituent, Claudia Morandi. We've referred to this bill as Claudia's bill over the years. And basically what it does is it tries to correct what has happened in regard to unintended consequences with various pieces of opioid legislation and with the CDC guidelines regarding prescribing opioids. What unfortunately has happened, and it happens often in public policy, is we have a tendency to react because there's an issue, and there certainly is an issue, as we've heard prior to this testimony, with the opioid crisis in the United States and in our state. But a lot of times we react and the unintended consequences are severe. And in this case, many, when I say many, I've heard from patients all over the country, many in Rhode Island, who have indicated that they cannot access prescription opioids because their doctors are in fear of retribution from federal authorities, state authorities. And these are people, as the bill describes, who are suffering from chronic intractable pain. So these are people who are not addicted to drugs. They need these opioids in order to conduct their daily lives. They need these opioids because they are in severe pain. Their doctors should be the ones who determine whether or not this is the correct treatment. And so we have made adjustments to this bill over the years. The Department of Health has worked with us. The American Medical Association has worked with us. And we believe what we're doing here is we're just clarifying that we need to be very cognizant of those patients who are using opioids daily or however they're prescribed, who are not abusing these drugs, these prescription medications. They are using them so that their standard of living can remain where it is. I'd be happy to take any questions. Chairman Casey, I don't know if there's anybody holding on the line to testify. Over the past 2 years, we have had no opposition to the bill. I don't know if Claudia is on with us or not. She can speak more eloquently about this than I can. I'd be happy to take any questions.
Thank you, Representative Amore. We appreciate your testimony. We did have one Randall Rose who we're going to try to raise on the phone. We couldn't reach him earlier on another bill. Is there anybody from the committee that has a question for Representative Amore? Okay, then we'll just stand by. We'll see if we can get Randall Rose on the line. If not, we'll then close the hearing, if that's okay with you. Stand by.
Fine with me, Chairman.
Thank you.
I have a quick question for Rep. Amore while we're waiting. This is Representative Fogarty.
Go right ahead.
Representative Amore, without giving away her HIPAA violation, what type of physician would be, is it a physical, not a physical therapist, but an orthopedic type of a doctor who's afraid to prescribe or something along that lines?
I think this goes across the spectrum, Representative Fogarty. I think it's all practitioners. And what has happened is, in some cases, physicians have told these patients, primary care physicians, I cannot help you here because my license is in jeopardy. Okay. I cannot help you here because of the restrictions on the amount that I can prescribe, even though I know that this is the proper treatment for you.
Yeah. The only reason I asked is I remember when we passed that bill that there was the problem was actually one of my constituents who happened to be like #1 on the list and all of his associates, and he is an oncologist. And he said, people with bone cancer, he goes, I'm not going to stop prescribing.
Right.
For my patients. So we did make an exception for that group, I'm forgetting what the title, the cancer specialist, the oncologist. So I didn't know if there was another specialty group that we could break out. That's why I was asking.
Yeah, no, I think it goes across the board, but
Okay.
you're right. I mean, a lot of this is cancer care, palliative care. A lot of these folks are veterans, and it's really sad. Like I said, I've heard from literally hundreds of people from all over the country. And by the way, this legislation has become model legislation throughout the country. It passed in New Hampshire last year.
Okay, well, good to hear. Good to hear. Thank you.
Thank you.
Thank you, representatives. We do have Randall Rose on the line. We're going to hear from him. Hello, Mr. Rose.
Hello.
Yes, this is Representative Casey at the Health and Human Services Committee. We have you
Thank you,
listed.
Mr. Chair.
We have listed you for House Bill 5247 for testimony. If you would, Mr. Rose, please keep it brief. We have 7 more bills to get to. I would appreciate it. Thank you.
Thank you. Yes, I understand this bill deals with a dilemma that we want to provide relief for people with chronic pain, but on the other hand, we want to avoid creating painkiller addictions. I just want to say that as presently drafted, the bill goes too far in one direction. It doesn't only deal with intractable pain. What it calls intractable pain is basically any pain that lasts longer than the acute pain. And whether that's severe or not, whether it's continuous or intermittent, and it says that any kind of long-lasting pain like that, the prescriber can, which may be a doctor or anyone who is a prescriber, can disregard CDC guidelines, can use whatever their judgment says, and not have to follow the laws to the contrary. And it's so I just think that I recognize there's a need for relief, especially with severe pain, but I don't think the bill is narrowly drafted enough for those reasons. I think it risks creating more painkiller addictions for treating pain that's not that serious. Thank you.
Thank you, Mr. Rose. Are there any questions for Mr. Rose? If not, I will close the hearing on 5247.